Hello, welcome to Eternity Now. I'm Chuck Young. Today on our show, we're going to highlight a wonderful organization here in Nashville. It's actually a Seventh-day Adventist organization. I want to introduce you to Ike DeVasier. Ike, you want to tell us a little bit about yourself and the organization that you're here to represent?
Absolutely. My nickname is Ike.
I've always loved that nickname.
And my real name is Mary Elizabeth. But I have been associated with the Middle Tennessee School of Anesthesia since 1971. And I have been, in my career, I have done anesthesia, I've provided anesthesia. I've also been a classroom instructor in anesthesia, and I have supervised students as they gave anesthesia in the clinical area. In 1982, the program director had a heart attack, and my bosses, the anesthesiologist who ran the school, asked me to become the program director. And so from that time on, I added program administration to my job title.
Wow. So what are some of the things that have been accomplished just since you've been there at the school?
Well, when I first came to the School of Anesthesia, it was a certificate granting school. In fact, I was a student there and I received a certificate in nurse anesthesia, but it did not offer an advanced degree at all. So to get in, you had to be a nurse, and then you would take your training there, and then you would receive a certificate. You'd still be a certified registered nurse anesthetist when you passed the certification examination.
Yes.
But as time went on, I needed to look at what was going on in the environment, and in the environment, things were changing. One of the things was that the students had to have a baccalaureate degree in nursing before they could be enrolled. And at that time, there were some 200 schools of anesthesia. And as soon as they changed the entrance requirement from the accrediting body, the number of schools in the United States went from about 200 down to less than 90. So we needed to make changes as well. So we had to begin to look at offering more than just a certificate. In fact, the need to offer a master's degree came about by 2000. By 2000, everyone had to have a master's degree. Now, we could join another university and could offer a master's degree. However, our administrators did not want to do that. They were very satisfied with the product we had. So one of the things I needed to do was to seek regional accreditation. And that was something that I was able to accomplish. And our regional accreditation is through the Southern Association of Colleges and Schools, Commission on Colleges. That was a 12-year process.
Wow.
And after that, we were able to offer master's degrees to our students. They had a baccalaureate degree coming in, and we were able to give them a master's degree when they graduated. Most recently, the horizon now has nurse anesthetists having to earn a doctorate. And my last effort was to seek accreditation for the doctorate. And we had to go through both accrediting agencies to do that. So beginning in September of 2013, the first doctoral classes will occur. Now, I won't be involved in that because I'm retiring, but my replacement was actually chosen last year, and I've just been a consultant this year to the president.
I see. Well, since you've retired then, who was it that took your place over there?
Dr. Chris Hewlin, CRNA, and one of my graduates took my place. And Chris, is a CRNA and my graduate. But the president is Dr. Ken Schwab, most recently of Centenary University in Louisiana. Now, Dr. Schwab is not an anesthesia provider. He's not even a healthcare professional. He's an educator. But I need to note here that while I've referred to Dr. Hewlin as doctor, he has earned the doctorate in nursing, as I have earned a PhD. and both of us can be called doctor. However, in the clinical area, it's not wise for us to be called doctor because it confuses patients. In the clinical area, they would think that maybe we're medical doctors.
Yes, and you can understand that.
Absolutely, and we're certainly not medical doctors. In fact, we're very proud to be advanced practice nurses, very proud of our specialty. So I just wanted to make sure that you understood that.
I think having that PhD or that doctorate, though, is very important to you guys.
We had to have that to be in our positions to lead a program that offers a doctorate. You have to have a doctorate.
Yes. Now, who can attend this wonderful place, MTSA? I mean, could someone like me attend there if I had the proper prerequisites for that?
Oh, yes, if you had the proper prerequisites. However, first of all, you have to be a nurse. And I don't think you're a nurse yet.
I'm not a nurse. Being a graphic artist, I don't think that's going to quite work.
That's a little way from nursing.
It is.
But you have to be a nurse, and you have to have a baccalaureate degree. You have to have really good grades. In fact, our average GPA...
That might cut me out right there.
Our average GPA is between 3.4 and 3.5. But you have to have at least a 3-point GPA. You also have to have at least 1 year of critical care nursing experience where you take care of the very sickest patients before you can even enroll and be admitted to the School of Anesthesia. The average number of years of experience as nurses in the critical care area our students have is 5 years.
5 years?
Yes.
And, so, and that's the average, but you have to have at least 1 year.
Right, at least 1 year.
I see. What will graduates of MTSA actually do when they graduate?
Any anesthetic that you need, my graduates can provide. They can provide regional anesthesia or general anesthesia. For instance, if you had a knee procedure that you needed to have looked at.
No time soon, please.
No. Well, if you did and you needed to go to your physician and they determined you needed surgery, then I'm certain you would want anesthesia to have that surgery.
Oh,
and
I definitely would.
Our graduates, that's what they do. First of all, they would, when you come into the, before you have the operation, they would have you, they would do a pre-op interview with you. They would ask you lots of questions about your history, about your medical history, about your family's medical history even, particularly anesthesia related. And then they would listen to your heart. They would actually have you open your mouth wide because nurse anesthetists and anesthesia people are airway specialists. They want to know how widely you can open your mouth in order to secure your airway. And then
that makes sense.
And then we would actually start an IV, put monitors on, and then give you some medicine and let you drift off to sleep for the procedure.
Oh, that just sounds so peaceful. You know, we may come back to some more questions about anesthesia later, but first I'd like to ask some questions about the school itself. Where is this school located?
The school is located in Madison, Tennessee. It's located on the campus of now Skyline Medical Center, Madison campus. But before Skyline was there, it was Madison Hospital and then Tennessee Christian Medical Center.
Yes.
We are located on that campus. The history of the school is very fascinating. And in fact, its history surrounds honoring God. You see, back in the day when the founder decided he wanted to attend a school of anesthesia, he searched for a school where he could practice his religious beliefs, particularly about Sabbath. He found none. So he had to attend a school where it was very difficult for him to worship on Sabbath. You see, he was a Seventh-day Adventist, and Seventh-day Adventists respect the seventh-day Sabbath. They believe that the seventh-day Sabbath was instituted at creation, and then a bit later when sin entered the world and God eventually gave the 10 Commandments in writing, he felt it important enough that he incorporated the Sabbath in the 10 Commandments, actually prefacing it with the word remember. And the Seventh Adventists also believe that, search the Bible as you will not find evidence that the Sabbath was changed to another day. So young Bernard had a very difficult time. He was very grateful to the nuns at the Norwegian hospital in Chicago where he attended, because the nuns allowed him to swap days with other students if they were willing, but he felt very uncomfortable having to ask. So when he graduated, he went to the General Conference of Seventh-day Adventists and said, "You need to start a school of anesthesia, because there are people who want to do anesthesia, but there's no place, if they're Seventh-day Adventist or if they keep the Sabbath in any denomination, there's no place for them to go to school." And so their answer was very simple. They said, "Go start one." Well, that was easier said than done. So Bernard went home and he prayed about it. And it wasn't long until he received a call from Madison Hospital to come to start a school of anesthesia. He felt that was indeed a God thing. And he started the school in October of 1950. And he started with 2 students. And today, there are 72 students. In fact, it's one of the largest schools in the nation.
What a wonderful explanation of that history, and how this school was founded basically so a man or other people could actually go to school and learn what they wanted to learn about becoming an anesthesiologist, and do it while still maintaining and keeping the Seventh-day Sabbath.
Absolutely.
I find that just fascinating. And that was in 1950.
Yes.
And you got involved with it in 1971. Is that correct?
That's where I graduated as a student.
That's when you graduated as a student in
Yes.
71. Now, that begs the question, though, does someone have to be a Seventh-day Adventist in order to go to MTSA?
I'm smiling, Chuck, because I'm asked that question so often by applicants. Because you see, on our web, on the World Wide Web, when you look at our catalog, we have our logo, and within the first 3 pages you find our Adventist heritage.
Yes.
And if you look further, you find the religion class that we teach. And so that's a genuine question applicants have. Do you have to be an Adventist? And the answer is no. It was simply formed so that those who do keep the Sabbath would have a place that respects the Sabbath.
Yes.
We have had students who are other faith. We've had many who are Christian. In fact, most of the students are Christian. There have been a few who are other beliefs other than Christian, and they have been either Jewish, we've had Buddhist, we've had Muslims, and then we've had students for whom the jury is still out as to whether or not there is a God. I recall one of the students after a religion class coming into my office and saying, "Miss Ike, I just wanted to tell you, I think there might be something to this God thing after all."
How about that? So people coming in without really necessarily having a relationship with God, possibly through those religion classes, they seem to be forming one, and maybe even being exposed to keeping the 7-day Sabbath like that. Now, in general, how do these people react to that religious class, the religion class?
Well, the non-Adventists are very polite. In fact, they seem to really treasure it. One of the applicants, even before she became a student, after she had applied, but before she was enrolled, this particular student was of a Muslim background. And one day she said, "Miss Ike," she called me and said, "Could I go to church with you?" And I said, "Sure, that would be great." And at church, she heard that Christ had died for her sins. That afternoon she was very quiet, and I asked her, I said, "You're very quiet. Can you tell me, is there a problem?" And she said, "No, I've heard of Jesus Christ all my life, but I never knew He died for me."
Wow. That's a strong testimony for what those classes can do.
Yes.
Well, how many schools of anesthesia are there in the nation, and how many are there in Nashville?
Well, there are 112 schools of anesthesia nationwide. There are no more in Nashville. There are 5 in Tennessee. But I would like to go back even to the general students who are Christian, how they react to it. We evaluate all of our classes. Every quarter, at the end of a quarter, we evaluate the classes. And I've always been amazed at how the students react to the religion class. First of all, students tell us that the curriculum is very intense, and it is. And
that's what I've heard.
It's very intense. And many of the evaluative comments indicate that they have, because it's so intense, they skip church on the weekend. And they're very grateful that we have provided this opportunity where they have liberty, if you will, to actually stop studies and actually get their spiritual batteries recharged.
You know, besides the obvious Christian mission that is involved with this school, what would make someone choose coming to MTSA over the other 111 schools out there to choose from?
I really believe the answer to that is the reputation of our graduates. Our graduates are highly marketable. They're very much sought after. Even times where people would prefer to have a seasoned anesthetist, they sometimes will choose our graduates over those. In fact, I had a call one time from an anesthesiologist in the Midwest, and he had hired one of my recent graduates. And he said, I really didn't want a new graduate, but when I interviewed, her name was Jenny, when I interviewed Jenny, she was amazing. And he said, I've made this call today to tell you that how wonderful she is, and I am so glad that I hired her not knowing how she was educated.
Well, what is it about the design of the curriculum that allows that to happen?
Well, to discuss that, or actually to elaborate on that, you have to first of all go back a little bit into the history of nurse anesthesia altogether. Nurse anesthesia started as hospital-based. In fact, nurses were the first discipline to actually give anesthesia. Physicians didn't enter until after World War I. And so in about the late 1800s, nurses started giving anesthesia. And schools started opening in about early 1900s. So the reason people had schools of anesthesia was basically to create their own anesthetist. And it usually happened in large hospitals where nurse anesthesia education occurred. And so typically, these schools could arrange their schedule so that every afternoon they had class, but every morning when surgery was active, the students could get their clinical experience. And students in that model were able to have clinical at the same time they had their classes. In other words, morning they could have clinical, afternoon they could have class. And that was also the old Seventh-day Adventist work model, that you worked part of a day and then you had class part of a day. And so that was very comfortable for our school as a certificate program and in the early years to do that. But as the criteria changed, as we have mentioned before, as the criteria changed and we needed to have more, universities began to have the schools of anesthesia. Rather than hospital-based, they became university-based. And in the university, there were many disciplines like physical therapy, nursing, and these students in these different disciplines all needed some of the same classes, like anatomy and physiology, pathophysiology, chemistry. And so as a cost-saving mechanism, the universities actually put all of these students from different disciplines into the same class. And That then created a problem because the university scheduled class at 8 o'clock in the morning or whenever the university set the schedule. And therefore the students had difficulty getting clinical experience. So a new model evolved, and that model became the front-loaded model, where the student, after they were enrolled in a school, took all of their academics for the first year, 9 months to a year, and then they went into the clinical area. So they stopped being nurses for 9 months to a year, and they just went to classes, and then they went to clinical. They had all this knowledge in their head, and they went to clinical and were expected to use it. But we did not go with that model. We had an alternate model.
Well, with this model, why would other schools not go ahead and use that same model?
Well, other schools couldn't use that model because they were university-based. And as a university-based one, they couldn't have the mornings free to do clinical anesthesia. They had classes throughout the day.
Oh, yeah.
But in our school, we were able to structure it so that we had an integrated program. That means that they came in and they did all their orientation for a month, and then they had their first clinical assignment within a month. Now, obviously, the instructor's very close to them. They have had a month of orientation, and then they go into the clinical area, and they're standing at the head of the table. The professional is beside them. The professional is thinking and guiding them in what to do. But they are nurses, and anesthesia is a discipline of nursing, so really, essentially, they're just adding to nursing. They're not sitting out and doing no clinical experience. They're just adding to it. And so that's been one of the reasons why. And another thing is that MTSA, the reason MTSA can do it this way is because of our regional accreditation. You see, we can offer the degree, and our regional accreditation through the Southern Association of Colleges and Schools is as an single-purpose, anesthesia-specific graduate degree institution. The phrase in there that's most important is single-purpose. The only thing MTSA does is educate nurse anesthetists. It has no other disciplines, just nurse anesthetists. In fact, the first graduating class that graduated with a master's degree, the speaker was one of the commissioners from the Southern Association of Colleges and Schools, and he made the comment, it's good to see a school focus on one thing and do it so well.
Well, how do they get their curriculum experience?
Very good question. Middle Tennessee School of Anesthesia has clinical affiliation agreements with every clinical site, or almost every clinical site in the Nashville and greater Nashville area. In fact, within like a 50-mile radius, we have students there. Also, we go outside of the area. For instance, our students will go to Nationwide Columbus Children's Hospital in Columbus, Ohio. And there, they will spend 2 to 3 months. The anesthesiologists there rent an apartment, and the students live there and practice doing pediatric anesthesia. An interesting note about that is that the accreditation requirement is that a student has to do anesthesia for 35 pediatric patients. And our students will have approximately 200 or a little more anesthetics, so they could really market themselves as pediatric anesthetists. In fact, because of the quality of our graduates, in the last hiring process at Columbus Children's Hospital, they hired 9. They were opening 11 operating rooms, and they filled them with 9 of our graduates.
So it's the number of cases and experiences that makes these students so appealing, but what else is making them marketable for hiring?
Well, that's an interesting question, and indeed the number of cases is very important, where the average, where the requirement is 550 anesthetics. Our students will have had 1,200, 1,500 anesthetics, so they're
twice as many.
And that's because they've done clinical the whole time. But more than that, the design of the program. Most schools of anesthesia will select a large facility where their student stays the whole time, and they have plenty of cases.
Yes.
Our school depends on the community, and instead of going to one place, the students will go, they will spend 2 months at one place and 2 months at another place, and they rotate among affiliates. Now that is very disconcerting for a new anesthesia student to have to, they think, I have it down, I know exactly what I'm doing, and they move to the next clinical site, and the next clinical site will say, what in the world are you doing? And they'll say, well, I'm doing it because such and such a place did it this way. Well, that's not the way we do it here. So by the time they've gone through up to 14 facilities, a new facility is just another affiliate to them. So when they're choosing to go to a hospital, the hospital, they orient very quickly, and that's very important for the graduate, and very important for the employer as well, to be so well oriented.
Now, how many CRNAs in Nashville would you say are graduates of MTSA?
I can't be exact on that answer, but the last time I did a survey, there were 85% of the nurse anesthesia providers in the Middle Tennessee area were graduates of Middle Tennessee School of Anesthesia.
You know, Ike, thank you so much for coming here today on Eternity Now and explaining in just the most wonderful terms what this very compassionate school is all about, because without it and this sort of thing, we couldn't have the surgeries that we have today. And it really is a beautiful thing going on over there at MTSA.
Well, I appreciate being able to come, and I would like to give God the glory for this school that should not exist because it was in such a small place. Thank you, Chuck, for having me.
Well, thank you so much for being here. Thank you so much for being with Eternity Now today. I hope you come back again.